The National Institutes of Health continued to lean into the use of artificial intelligence last year. The NIH has now initiated more than 100 AI pilots over the last few years. Those efforts ramped up as the health agency also navigated staffing cuts and other turmoil in 2025. With more detail, Federal News Network's Justin Doubleday joins me now. Justin, great to have you.
Good to be here, Terry.
So what is going on at NIH when it comes to the use of artificial intelligence?
Yeah, the NIH is really a prolific user of artificial intelligence when you compare it to a lot of other federal agencies. And the number of AI use cases at the NIH increased to 124 in fiscal 2025. That's up from 82 use cases tallied in 2024. And that's up from 47 tallied in 2023. So you've seen almost a tripling of AI use cases at NIH in just a couple of years. The Department of Health and Human Services as a whole saw a 65% increase in the number of AI use cases in 2025. So clearly, HHS is kind of all in on this AI, using AI. Now, NIH has been able to take advantage of the OneGov deals that the General Services Administration has struck with a lot of the leading AI firms. But at the same time, it's also just having to make up for the fact that there are less staff at the NIH over the last year or so. Here's Nick Weber, Acting Director in the Office of Scientific Computing Services at NIH.
We've also had to weather the storm of changes in personnel, rifts in different parts of the organization, and everyone's grappling with how can we be more productive, how can we make sure we still provide the services that are needed with a diminished staff. And AI has really been a boon toward being able to do that, both from the administrative and kind of health coordination side that we do at NIH, as well as delivery in the clinical center and across the board. So I think it's both out of necessity and out of just interest and opportunity.
Well, this may be the first place where we're matching the promise of AI to fill in for staff reductions. What are some of the specific ways that NIH is using AI?
Yeah, Weber said that, they're using it across the spectrum of NIH work, from administrative tasks like analyzing the agency's grants portfolio to research support, lab work, clinical assistance, preclinical work. Weber, during his appearance, pointed to a lot of really interesting examples. One of them to pull out was NIH's efforts to create what he called domain-specific small language models trained on NIH's health data sets. So these are not, just letting ChatGPT run rampant or any of the big, frontier large language models on NIH's data sets, but, fine-tuned models that are going to be able to analyze NIH's core data sets around for things like Alzheimer's research. And then NIH wants to make those data sets and those models available to the broader research community, where they can ask questions and work with these more specific disease data sets. And so that could be a really interesting use case for how NIH does things. But really, Weber said they're looking across the board at how AI can, in many cases, be an assistant across the different work that NIH does.
Are they running into any particular challenges as they roll through this approach?
Well, it's probably a common challenge, and that's scaling these different pilots. As I mentioned, over 120 different AI use cases. Many of those are in the pilot phase or in the pre-deployment phase. And, NIH is a pretty big and diverse organization. And so Weber, from his perch at the kind of central IT office, said that scaling is really the big challenge at NIH.
We have so many pilots and we have so many opportunities to bring things to the broader NIH community, and doing that in a way that is not haphazard, in a way that's not duplicative, because there's so many ideas. Somebody probably has an idea over here that we also had over there. NIH is a big place, is a real challenge. And I think, probably the areas that we struggle with the most are coordination across a big, complex organization that has 27 institutes that have all been, highly autonomous for years, and there's more push to centralize on things. That's a challenge.
So, Justin, what role is NIH's Center for Information Technology playing when it comes to scaling AI across the whole gamut of NIH efforts?
Yeah, there are a few different things that that central IT office is doing at NIH. Recently, or just within the last couple of years, they've established a generative AI community of practice. Weber said that now involves roughly 2,000 people across NIH, so a pretty substantial amount of the 17,000 or so employees at NIH. He said the group meets twice a month and offers training, including for NIH leaders. And what that group did was really help just normalize the idea of using AI and showing ways that NIH could safely and securely use AI in different ways. Another thing that the central IT office is doing at NIH, he mentioned there's 27 separate institutes and centers. That's very diverse. A lot of those institutes and centers have a lot of power over their budget and what they can do. Weber said that they're trying to push out things through their central funding program, but they're also trying to push out playbooks. So for enterprise AI rollouts, that means making sure that people have a central kind of playbook for IT service support for an AI that might go out there into the wild or at NIH, or just communicating with different stakeholders who might need to know about a new AI tool that they might be able to leverage instead of starting a new AI pilot of their own. And so there's this big effort just around communication coming out of NIH's Center for Information Technology when it comes to AI.
With all of these pilot projects in the works and all of this different administration, what's next on the horizon for AI at NIH?
Well, one thing that Weber mentioned NIH is concerned about, which I thought was really interesting, is these OneGov deals and kind of the long-term implications of these really astounding deals that GSA has been able to strike with these different AI firms. They've been able to strike these deals where OpenAI and some of the big AI firms are offering entire agencies access to these AI platforms for $1 a year or less in some cases. And of course, that's been a boon for agencies getting into AI and starting to roll out some of these use cases. And Weber alluded to that at the NIH. It's helped them really get the ball rolling here. But they're also kind of concerned about what are the implications down the line when some of these perhaps really good deals run out and they have to renegotiate.
That's a good thing, but it's also a worrisome thing for many at NIH because this is what I like to call the drug dealer model, right? They get you hooked, and then you'll pay anything to continue to use it. And so we're worried about what is it going to look like? How are we going to decide when we have people using all of these different products? Where do we invest? How do we invest to make sure people can continue to get the benefits of the products? In general, I think it's a great thing. I think it's a great way to partner with industry. I am worried about the back end as to how we're going to sustain these things when we've become so reliant on them and it no longer costs $1.
Well, Justin, it sounds like NIH may be showing us what the frontier of effective AI deployment looks like.
Yeah, we'll have to see how they manage all of these different issues, but certainly a lot of commonalities, I'm sure, across the federal government and how they're addressing these types of things.
That's Federal News Network's Justin Doubleday. Justin, thanks for joining me.
My pleasure, Terry.
You can find his story at federalnewsnetwork.com.